Hi, everyone. Welcome to this episode of Level Up Leadership Podcast. And I have a very fun and special guest here today. Michael Emery and I went to school together, not like kindergarten. We went to MBA school together. And nobody says that. MBA school is not what we call it, right? Business school.
B school.
B school. Yeah, we went to school together, and we happen to kind of be in a shared industry now, which is really cool. Not many of us in the program. I think you and I were it in like this world.
Yeah, I think we're a few of the few medical personnel, professionals, however you want to call it, in the space
Yeah,
within the program.
we
So a
were
small subject
definitely.
of a subsect. Yeah.
We were definitely not in the like I think oil and gas and finance and
Space
all of that.
science, like Fred.
Yeah, that's right. So I'm excited to talk to Michael. Michael, tell us a little bit about. Tell me your company, your role there for the audience.
My name is Michael Emery. I'm privileged to be the Executive Vice President of Senior Living. I have a background as a nurse and nurse practitioner, and my company is Curana Health. What we do is, our mission is to improve the health, happiness, and dignity of senior living residents. Which I think that's where James and I connect a lot. I mean, you look at his LinkedIn handle; he's Mr. Senior Living guy, and I'm the EVP of Senior Living for Curana. And our mission is to just really redesign the care delivery model for senior living residents, which
Hmm.
are a highly vulnerable population. And if you look at hospital to home, it's really kind of the wild west when it comes to
Hmm.
focus, but it's getting a lot of attention now, and for
Yeah.
good reason.
Yeah. Let's spend a little bit of time on your company because I'm actually not too familiar with it, other than you work there. Tell me, for a senior living operator like me, how or why might I be introduced to a company like yours?
No, great. So it's interesting. It's less of a pull and or less of a push to you. It's more being pulled by
Hmm.
operators because we've created a good brand in ourselves. So we're about 2 years in naming wise, but
Hmm.
really 30 plus years. My legacy company was actually called Elite Patient Care. So I've been
Hmm.
employed by some version of the same company for the past 12 years. I
Yeah.
grew up and started up in skilled nursing, and I'll get to the answer to your question because you and I can talk a lot.
Yeah.
I started as a nurse practitioner. I got recruited by a friend of mine that was a recovering hospitalist and said,
Hmm.
"Hey, you're going to do nursing homes?" And I said, "No, I'm not. I'm going to do something cool like
Yeah.
cardiology, pulmonology." And you know what? I did. And I
Yeah.
brought two of my classmates, and we made four, and we grew the practice. And through a couple
Mm.
transactions, the most recent one that was done about a little over 2 years ago was made by a venture capitalist company, which they've got big negative association, but
Sure.
really trying to solve the problem for senior living. So how a senior living operator like you, a lot of times there's fragmentation in the space when you're talking
Hmm.
about a physician or nurse practitioner services. We call them advanced practice providers, and how they care for your residents in your community.
Mm.
And a lot of times it's local or maybe some national practices, but there's not many that are of scale. And at this point in time, we are actually the largest provider of post acute or senior living in the country.
Wow.
We are about 33 states. We have 850 either physicians, nurse practitioners, or physician assistants across the country. We service about 120,000 patients a year. And we're over, I think it's like 1,200 and changing communities across the country. So a lot of times, you know, just get cold called,
Yeah.
conferences, introductions, relationships,
Wow.
but they're seeking out one of the big attractors is they're seeking out some version of value-based care. And value-based
Hmm.
care is a very big buzz term, right?
Hmm.
People
Yep.
say it and they have no idea what it is. Uh, we have, I would say, three flavors of value-based care. We have an MSSP ACO, so Medicare Shared Savings Program ACO. We've got a high needs ACO, which is high needs ACO Reach, which is
Hmm.
formerly known as DC or direct contracting, and then we have a Medicare Advantage plan. You
Hmm.
know, and comparative to Medicare Advantage, a lot of people know Optum, the not even the
Yep.
800-pound gorilla, the 10,000-pound gorilla.
Yeah.
We're like number two or three, and it's a huge gap between their 100,000 plus members and
Yeah.
our 7 8,000.
Yeah.
So kind of a little elevator pitch to the answer there, but I think it's a lot of times is they're attracted by the value based care. They want some consistency, and what we're able to do through value based care for me is really a payment mechanism that aligns interest is to deliver a more full care experience in our care delivery model at the site than most what we call fee for service providers that need to
Mm-hmm.
see someone and get paid and move on. They're not bad clinicians. Don't get me wrong. It's just they're incentivized to see you and move on,
Mm-hmm.
not to manage your overall care through the spectrum until, and keep you aging in place in the community in which you live and love. And one that runs, I've seen
Mm-hmm.
all the remarks and reviews. They're always glowing, and he does a
Yeah.
great job. And we love to partner with communities like yours.
Yeah. Thank you. I want to make this like super easy
Yeah.
to understand for people who I think some of our bigger operators in the senior living space are so familiar with all of the intricacies. But I think a lot of people forget, and myself sometimes I forget this, that so much of our industry, our profession, is made up of smaller players like Abella Groves. And
Mhm.
so in those places, we're in a kind of a rural area of San Antonio, just outside of San Antonio. And so, first of all, most senior living facilities are not a medical place, right? So, assisted living, independent living, we ourselves are not clinicians. So, we need to partner with advanced practice professionals to come in and support that. We're not going to prescribe medications. We're not going to order labs, but we need people who can do that. So, for somebody like me, if we didn't have contacts in the industry and we're starting off an assisted living or memory care facility, and we have residents who are coming in, they have doctors all over the place, they have specialists all over the place. Um, that's a lot of problems, actually. So having, and I've been there where we've had to manage 40, 50 different physicians groups and pharmacies, and I mean, you need a whole team just to communicate with
Mhm.
all of them. So, how might Curana help an organization who's dealing with all of that friction of like so many entities to coordinate?
No, the fragmentation is huge, and one of the
Hmm.
things that compounds it is HIPAA. Absolutely
Hmm.
necessary, but
Hmm.
one of the things I heard probably like 10 years ago, the American Medical Director Association conference was silos of excellence. Everyone's doing a great job, but we're all in silos. We don't
Huh.
talk, right? We don't talk. You're doing a great job, but through restrictions of HIPAA, natural boundaries of communication, we can't share information very freely. A lot
Yeah.
of smart people are trying to break that down. But to solve a problem, and break it down simply, what we do at Curana Health is say, we're going to deploy more assets than any other company, right?
Hmm.
And we can do this because we are taking risk on these lives. We're assigned a benchmark. Medicare makes this benchmark and says, hey, if you can provide better care and reduce avoidable hospitalizations, which is one of the biggest cost
Hmm.
expenditures on any life, if you're looking at that, or other areas, then we're going to split the difference with you. You're going to go at risk, right? And so when we look at it, we can provide more talented people to care. But how does that add? Because James, one question you said, or one comment you said was, there's too many people,
Hmm.
right? So if we can help your staff, because when we're looking at that, what's important to a community like yours? It's length of stay, right? But I
Hmm.
love that because length of stay means they're out of the hospital. It means
Hmm.
they're living well in their community, right?
Right.
We're incentivized as well to keep them in their community. They're
Hmm.
incentivized to be in their community because it means they're on the hospital. When they go to the hospital, which I'll throw a big asterisk, is necessary at times for acute events,
Hmm. Right.
their morbidity and mortality statistically goes up. So we're very much aligned there. So how we help and partner, whether it's a small rural, best in class or community like yourself, it's to really say, hey, we understand there's patient choice, but can you be our choice? Can you believe in the model? We're going to work and we're going to dedicate one of our on-site care concierges that is clinically fluent, that
Hmm.
knows what a senior living community is, that knows the fabric, to be an extension of your staff,
Hmm.
right? To help coordinate with those prior authorizations, to coordinate with home health, therapy, lab, and really be that and work with you and not only silo that information, but share it and say,
Hmm.
hey, you know what? They went to the doctor. Let's help arrange that doctor appointment. Take that burden off your staff, but keep them informed so they
Yeah.
can focus on the other aspect of care and make them a little more efficient so you can serve more
Mm.
residents. And then having here's one terrible thing: it's like you have one throat to choke when we have a majority
Mm.
of the patients. Like you have one stakeholder.
Mm-hmm.
We set up regular care meetings, right? So taking away what a lot of people in the skilled nursing, which is a higher acuity for those that maybe not are clinical that listen to James' podcast, there's a lot of structure there. We're
Yeah.
providing that structure in here, but also not having purposeless meetings. It's trying to coordinate the care together to give that bi-directional communication. And who benefits? The patient, their
Yeah.
family member, the loved one, because we are taking those efforts and making that information available, whether it be through a portal or just communicating with the community in which we partner with to say,
Mm-hmm.
hey, we did this. And one of the things I love about our model that we're designing, and I'm really excited about my journey from leading operations for Curana into senior living, is
Yeah.
that I get to design this.
Yeah.
And in the mechanism of that term, that buzz term, value based care, it allows me the opportunity, because a lot of people think, well, value based care means you're cutting costs. That's
Mm-hmm.
actually wrong. It's actually investing more money upstream before you're putting out fires.
Hmm.
You're trying to prevent smoke and small smoldering fires and identifying them earlier by touch points that aren't necessarily have to be billable encounters. I'm not
Mm-hmm.
worried about how many times I see and I can bill. I'm worried that the resident, your community member, is in their home and doesn't go to the hospital. If they have acute stroke, they need to go. And we're going to
Yeah.
make sure they tuck in very quickly and they come back to you as well.
Yeah. So, value-based care, would it
Mhm.
be, what would be like the opposite, or what is value-based care?
Mhm.
Maybe like an anti what, or help me understand value-based care. You
It,
know.
yeah, it's basically saying, like, here, like, the way to think about it is like fee for service. You'll hear a lot of time. That's
Hmm.
your traditional business. See someone get paid. You
Right.
do a service, you get paid a fee. Value based care has different flavors, but the concept is there's this available bucket of money on spend. So
Hmm.
Medicare or whoever looks at a patient, an aggregated patient, a grouping of patients, and says, we believe this demographic of patients typically cost us $20,000, making up numbers.
Sure.
If you can provide care for less than that, we will split the difference with you,
Hmm.
some form or fashion, depending on how confident you are. There's also downside risk. So if we spend
Hmm.
over, you're responsible. So basically, you're saying, I am confident in the model that we've been able to deliver and devise, that we're going to keep people aging in home, and they're going to reduce the avoidable hospitalizations, those unnecessary ones, because we did that extra medication check, that
Hmm.
modification. We connected or touched that patient and made sure that we recognized that they were a little confused more than normal, because we connect with them so often, and we are able to intervene and prevent that acute exacerbation of heart failure, fluid overload. So
Yeah.
value-based care is holistically, it's a buzz term, but it's a model that says, here is this, and care for them however you need to, and try
Hmm.
to improve their outcomes, which really aligns. And I think it's kind of polar opposite of fee for service, but there's some common threads.
Yeah. Do you think value-based care over time could potentially feel like the goalpost moves after a while?
Yes, because you look at our ACO, there is without getting too technical, there's a
Hmm.
5 year like benchmarking with multiple
Oh.
stages that you have, and it resets, because they also
Hmm.
say, it's like, hey, if you change the game, we're going to do, after 5 years, we're going to do a 3 year look back at what your costs are annually. So there is
Yeah.
also look back. So there's that. It's like a sales agent, right? If
Hmm.
you've ever done sales, it's like, your quote is this, you killed it, great job over the
Yeah.
past 5 years, your goalpost moves.
Right.
All right.
Right.
And so
Yeah.
when we model ours, it's to be a long standing, right? To
Hmm.
really drive down cost. And the wonderful thing is, driving down cost means our patients stay healthier and happier and in the lowest cost setting, which is an assisted living, independent living, our
Hmm.
home.
Hmm. So, if I'm looking at the trajectory of a typical person who lives in a memory care community,
Hmm.
you're saying, okay, so without all of these services in place,
Hmm.
and we're just throwing out numbers for illustrative purposes, let's
Hmm.
say that whoever's benchmarking this information says a person with this diagnosis at this age generally costs about $20,000 in medical expenses a year.
Hmm.
And so, if you and everybody who's involved in this person's care can keep it down to $18,000, then you split that $2,000 savings with us.
Correct.
Okay, so versus the fee for service model that we're all used to, which
Hmm.
is like whatever happens, we just keep paying you each
Keep
time you
paying you.
go right. Um, That makes sense. And so ACOs, accountable care organizations, not that many people actually understand it in senior living because, again, we're not a medical model. We're adjacent to medical.
Mhm.
So, what do people like me need to know about ACOs, and why would it matter for us to know companies like yours and what ACO means, versus just like letting every resident just have whatever physician and home health and therapy they want?
It, yeah, great question. And for me, it's you're seeing more complex, sicker patients that are coming downstream, right? Where we
Hmm.
see this flow of where the hospital trend happened many years ago, where they don't sit in the hospital. There's about length of stay in the hospital needs to be
Hmm.
short. There's very
Hmm.
predictive elements that hospitals and hospitalist groups predict to. So they naturally spilled over to skilled nursing, long term care. Well, that continues spills down where you're getting more complex. I would say, if and please correct me if I'm wrong, in senior living, you were more hospitality than healthcare,
Hmm.
right?
Yep.
Kind
Yeah.
of
Generally.
akin with a hotel that provides a suite of services a little bit more robust than but like a high end hotel. But
Hmm.
that's I don't mean to categorize because hotels do a great service. It's the high end with complexity, but you're continually forced to solve for healthcare issues because the patients that are coming in or the residents, apologize, are more medically complex,
Hmm.
right? And so they're complex, and so you need to seek it out. The reason is that why ACOs are important. A lot of times, companies like yours, senior living operators, their experience with ACOs are hospital ACOs that
Hmm.
basically say, you do this or else.
Hmm.
We say, we want to care and deliver better care for your residents, and we can potentially share in the risk because the ACO allows us because there's very clear laws on kickback and anti-kickback. We can actually share because you are a partner in this. You're
Hmm.
working really hard to care for these residents, these members, these some patients, depending on where you are, and how are you being compensated for that? You have
Yeah.
skin in the game, and so
Mm.
ACOs are important because it is the future of healthcare.
Hmm.
Medicare is pushing people here. They're pushing people by developing new through CMMI. They're developing new programs,
Hmm.
and it's not a matter of if, it's when. And ultimately, Medicare is innately selfish, right? They want to
Hmm.
cut costs. They want to provide
Has to
it a
be.
less. They have to
Hmm.
survive, and so they're looking and studying these, and they want as much information as possible, and they want to incentivize groups to be proactive and redesign. And so I believe the future, everyone will be in some form of bucket of value-based care. I
Yeah.
don't know when that is, if it's 5, 10, 15, 20 years, but the sooner you understand it, the better you prepare to operate your community and probably manage and bring care delivery improvement to those that you serve.
Yeah. Yeah. It's interesting, Michael. We, in our industry, because we're seeing a little bit more hospitality than we are medical. I mean, technically that's true. None of us are medical, but there are degrees of independent living, assisted living, memory care. And when you go down that chain, you have, again, very wide brushstrokes here, but in independent living, you may not have a lot of complex medical conditions and scenarios. But as you age and as your care needs change, generally, residents in assisted living are going to need more medical assistance and care. And then if you have a chronic disease process like dementia, then you're definitely going to have a lot of medical stuff going on.
Mhm.
So, but even with all of that said, senior living in general um, tries not to play too much into the, like, we don't want to pretend to be medical, but or maybe not, but as a result of that kind of thinking, maybe myself and my peers haven't educated ourselves enough to understand companies like yours, to understand value-based care, understand ACOs, and to care enough to be proactive in these partnerships. And I'd have to imagine a lot of times operators are meeting people like you and talking to companies like yours and feeling like, what's the sales pitch here? When what I'm hearing as we're talking through this is maybe we on the operator side of senior living need to actually start going out and finding guys like you to say, hey, we know the future of senior living includes the idea of keeping people out of the hospitals. And what you said, which is really interesting, is how to incentivize senior living to participate. Because other than like doing the right thing or keeping our residents longer, why would a business that has so many other focuses put some strategic time into building these types of partnerships out or piloting or you know testing things? So um, it's really eye-opening. We had a different topic in mind when we
Yeah.
agreed to talk, but I'm just fascinated, so let's just keep rolling with it.
Yeah.
Have you heard about the guide model from CMS?
Yes. So we actually
Yeah.
applied for it.
Hmm.
So
So
we'll find out midsummer if we got accepted, but we did put our applications.
yeah.
It was interesting because it's by, I think, company 10. So we submitted quite a few, not as
Hmm.
just but just other process. But yes, very familiar with it.
Yeah, I'm very curious to hear about your thoughts in that. Again, senior living isn't directly implicated by Guide because it's a CMS program, and we are not a generally a bene- beneficiaries is the wrong word.
A biller of,
There you go.
services. Yeah.
Right. So we don't ever receive funds directly from Medicare. So it's not a direct program for us, but I see all of the implications of senior living in participating in Guide. So I'm curious for your thoughts. For people who don't know what Guide is, I don't know
Mhm.
the exact acronym, but I'll give my version and you fill in
Yeah.
any gaps that I've had here. So the Guide model from CMS, which was just announced, is essentially, in my mind, a reflection from CMS, which is the Center for Medicare and Medicaid Services, that is trying to help caregivers of somebody living with dementia to be better caregivers. And the hypothesis is that, okay, Michael's taking care of a family member who has dementia. We are going to provide resources and funds for him through the Medicare benefit to help him be a better caregiver and care provider. And if we do that, Michael is going to do a good job of keeping his loved one out of hospitals and nursing homes and et cetera, et cetera. So they're taking the upfront kind of financial bet that if they make you a better caregiver, then your loved one will benefit. And then down the road, we don't have to pay as many hospital bills as a result.
Yeah. I think it's exactly, the theme and thesis for, what CMS is doing. I think there's a lot of great benefits. It just made a lot of sense for an organization like us to really apply for it. I actually had quite a few, home health executives of large national home healths reach out because there is a respite part of it.
Yep.
There are multi layers in it, but I think you're absolutely right on the general thesis and theme of CMS saying, how do we incentivize and support, right? Some of it monetary, some of it, just connecting with the right kind of groups that can really impact and improve
Mm-hmm.
care.
Mm-hmm.
And there's so many levels to it. It's very complex. We actually dedicated a FT, one of our staff members, and he did an amazing job. I was kind of an input thought person that contributed to
Mm-hmm.
that application, but not the author of the application itself.
Yeah.
But it's a new entrance, and I believe the final kind of selection comes out in June or July, and I believe it's an 8-year program, so it's a
Mm-hmm.
one time application, which things can change.
Yep.
But I do believe in our care delivery model, we satisfied a lot of the things. We didn't have all, and that's okay
Mm-hmm.
because I think there was thoughtfulness when they designed this, that they knew not anyone, there's no unicorn out there that could solve and deliver on all these. There's
Mm-hmm.
partnerships that need to be made. There's alignment that needs to happen. But there are, I think, two tracks, and one of those tracks is like a novice track that you can
Yep.
build over the course of it, and they actually provide some kind of funding so you can invest and make those improvements.
Right.
But the thesis is absolutely, I think, extremely powerful. I love
Mm-hmm.
the attention to a very, very vulnerable population that there hasn't been a lot of dollars around,
Yeah.
right? And I think for them to focus on this key area. There's a little selfishness there, but I
Mm-hmm.
think the right intent and the thoughtfulness of the program, although in its infancy and not even starting, I think it could do a lot of things, and we're excited about our opportunity to participate in it.
Yeah. I'm curious, did you apply as the first group, which is like we're new to it, and because I think there's a $30,000 lump sum to help specific organizations get basically ready for the
Mhm.
program, and then there are others who can apply that basically state that we're ready to go, and let's roll with it.
Yeah, I think we applied for the novice just because there were certain areas that we weren't sure, and I think there's some flexibility there too, where
Hmm.
they will actually assign you. So it's not a fault. Like if you select as an expert, they could default you, I believe, and I could be potentially wrong. So throw a big
Yeah.
asterisk on that. There
Yeah.
is some understanding that this is brand new, and
Yeah.
although we've dedicated a lot of research and we've got some consultants just to make sure we're applying appropriately and being good
Hmm.
stewards of how we represent ourselves. But also, I believe there's a function of like, hey, you actually qualify as expert or
Okay.
novice, and they
Yeah.
will help. But I believe we went under the impression that we would be selected as novice with probably a confidence interval of
Hmm.
50%
Yeah.
because it's just so new. So
So for listeners who are, you're hearing this for the first time, the CMS website gives you a lot of great information about the guide model. Also, the think tank group, a group that we put together, one of the small groups actually did this. I was in that small group, so I should know what the acronym stands for.
it's somewhere in
But
there.
yeah, but I don't. But I know what the program is. So a lot of good resources out there for you to learn about it. But if you are let's say you're an executive director of a senior living community and you're hearing about Guide and you're still listening to this episode and you're like, okay, well, why do I need to know about this? I'll tell you why I, as an owner operator of a memory care community, am excited about Guide. I haven't applied because we're not a Part B Medicare biller, but I'm kind of in the wings waiting for because I think the people who do apply and get green lit as, yep, you can do this 8-year project here with us, you have the ability, in fact I would say you would almost have the necessity to find partners like a Bella Groves that can provide dementia education, that can be a site for providing respite services for that family. You also have to the program kind of team captain, if you will, also has to be able to provide things like the 24-hour hotline for families that need to call and ask questions, because
Mhm.
dementia is not 9 to 5. It happens every single moment of the day and into the night. So these are all specific parts of the guide model. They're meant to give you practical things like dementia training, dementia support group, 24-hour hotline, respite services. Um, so I'm excited. I'm in the wings, essentially waiting for whoever gets approved to
Mhm.
say, "Hey, we need a dementia expert on our team." And I'm curious though, how or why senior living would want to participate, because there's an expense component to it from the facilitator, right?
Mhm.
So, or from the memory care community. And I'm assuming, kind of a callback to an earlier part of your conversation, I'm sure there are laws and things around, making sure that it's done appropriately and it's not like a kickback, but it's more of, if you are part of an interdisciplinary team that is getting reimbursed for this, then the program lead can maybe divvy up, hey, we think that this service is 25% of the pie, and here you go. Is that?
Yeah, I'm not an expert in the details of that, but
Hmm.
absolutely, I see it as like, for our company, we're probably one of the most compliant and err on the side of over compliant. We have a
Hmm.
great chief compliance officer, and so we vet a lot of these programs. I say we don't chase a lot of shiny objects and
Yeah.
put random applications in without a lot of thought. But yes, I would see that there'd be opportunity to incentivize participation, and that's what I would say is, how do we contribute, because you're working hard and dedicating resources. There should be value for that, right? To be able to,
Hmm.
we always say
Hmm.
no money, no mission. Healthcare is one of the spaces where making money is a negative thing. But what you
Hmm.
say is, what are the money that we make allows us to grow and impact more care, more seniors that we serve, hire well qualified, professionals, and give them employment that cascades to their family. So it's ripple effect. So
Hmm.
for us, we want to be a partner with whom we choose to partner with, and we mean that in every aspect.
Yeah.
Partners may disagree, but we're going to over communicate, right?
Hmm.
But we're going to get to we've been able to create great lasting partnerships while also being innovative and developing. And communication is one of the biggest keys. It's
Yeah.
just sitting down and doing, but also not trying to cut out anyone and saying, "Hey,
Hmm.
we are a team," and we really mean that, because we are narrowly focused. A lot of people ask us and what we do. Why don't you do this home health? It's like, that's not our core vision. We know
Yeah.
what we do and we do it really well, and we need partners for the rest. And with Guide, we will need partnerships to be able
Yeah.
to service a lot of the things that you mentioned. And once we get approval, we'll start kind of figuring out how to implement. And
Hmm.
I think there's a planning period too that you get to kind of get
Yeah.
going. And so that's kind of when the real work will start. The
Yeah.
application was a doozy, but also the real work starts afterwards.
Yeah. Well, I think this is a really exciting move, because you know what, no offense to CMS if anybody from there is
Yeah.
listening to this, but CMS is not generally known for taking, big risks with really, really progressive thought here, which is like, can we help people so far upstream that we're gonna, affect this all the way downstream? And forgive the jargon, but what we're saying is that help them early in the disease process of dementia, so that when you get to the advanced stages, the medical need isn't as big because you've
Mhm.
done enough intervention before.
Yeah, you've wrapped them in the support network that can care for them and anticipate and
Hmm.
understand that loved one that now is a resident or patient and how to care best for them. You're
Hmm.
absolutely right, and we jokes about CMS, but CMS is a ginormous behemoth, right? They
Totally.
don't
Yeah.
they can't make too big of because there's so much at risk for what they do. They have to be a slow moving, methodical, and I think they have functions that are trying to be innovative. And there's a lot of exciting things like DC and ACO, high needs reach, but it's hard, right? It's easy to
Hmm.
be critical when we're
Hmm.
small and we make jokes, but ultimately, I think they allow us to function, and so
Yeah.
we're trying to participate and provide feedback, and feedback is derived by participation.
Yeah. Well, I'm excited. So CMS keep doing stuff like this,
Yeah.
and I think senior living needs to pay attention to what is going on from CMS and from our medical partners, like you guys. If you said it, that, and we have a term for it actually internally at Bella Groves. We call it the social contract of care. And
Hmm.
so there's an image that we put out for our families, because families also don't understand how much is involved in the overall coordination of this. And so at a mom and pop memory care facility you go to, you may have good feelings about, okay, found a place for mom, she moved in, and hopefully everything is good from here. But you've also, I mean, that's just one piece of such a big puzzle. You still
Hmm.
have to manage medications, doctor's appointments, home health, when is hospice appropriate. And if the senior living leader at that community or that company is not equipped to help guide you along in that process, you, the family member, are still burdened with all of these complexities, right?
Hmm. Absolutely.
Yeah.
When we look at especially in senior living, the patient and the family are almost so interlinked, depending on their diagnosis, right, and their
Hmm.
decision making capabilities. So we can't lose sight of who we're serving. It's not just that patient or resident; it's their family as well,
Yep.
because there is that when you talk about caregiver burden or burnout is
Hmm.
real. I mean, there's a
Yep.
reason why respite has a place, and for
Hmm.
those that aren't familiar, it's just allowing someone else to care for the loved one, to give you a break, to take a breath, go on a trip, enjoy life, or regroup for the continued journey of caring for that loved one in which you've dedicated a lot of time,
Hmm.
effort, and resources to do. And so respite is a huge part of the solution. And I think guide just in itself is just hopefully another layer of support that
Hmm.
makes it a little bit better. And education's huge. We
Yeah.
can't
Well,
educate enough in this about healthcare.
these are really, really great signals from really big players in the industry, in the not even just the industry, it's the ecosystem of
Mhm.
health care and senior care, that are pointing to this idea that, guys, if we don't change the way that we're doing it, we've got a massive, bill at the end of this meal that none of us have the
Mhm.
pockets to pay for. So it is a good sign that that enough stakeholders are trying to do things a little differently.
Absolutely. The environment's completely changed. Earlier
Mm,
we were out, elevator pitching, selling our wares. We had great partners, and now it's completely opposite. We're, attending Senior Living 100 or Nick, and people are
mhm.
coming to us. We're having
Yeah.
keynote speaking opportunities. Our CEO, Mark Price, who does a great job leading the organization, is out speaking and traveling. And, it's a great opportunity, but it doesn't, just because we have dialogue doesn't mean we don't have to deliver. And for us,
Mhm.
it's not just one solution. It's implementing and not just planting a flag in a community. It's getting depth, developing systems and relationships, because you know you have a great one community. Those that have 100, everyone is different.
Yeah.
And so for us, it's about delivering a scalable but customizable product and care delivery model that really services the uniqueness of that community to deliver it. But yeah,
Mm,
senior living to me is an exciting space where I think they're getting the appropriate attention, and I'm excited to be here and part of a
yeah.
great team trying to improve healthcare.
Yeah. That's amazing, man. The more I'm learning about your view and your role in this puzzle. Senior living is it's a puzzle within a puzzle within a
Mhm.
puzzle. And
Mhm.
so I've often um, thought, and I've kind of empathized with partners and partners of senior living, and I think, oh my God, you've got so much um, tangled wires to untangle here with us,
Yeah.
because our industry, I mean, we're fragmented within just
Mhm.
within senior living, much less the overall healthcare uh, um, view. Even within senior living, there's just so much variety and so much different size. And when I think about EVP of senior living, that's like 100 different categories of things that fall under there.
Yeah, it's a fun space to be in.
Hmm.
Leading a large health. I mean, we're large. We've grown. I've still have that startup mentality, but as an
Hmm.
organization grows, there's necessary. We're bringing in more talented individuals to help focus because there's so many problems within problems to solve or opportunities to impact care. But yeah, senior living itself is big. I think I can take a lot of my experience in that more acute, skilled, long term care, feed that in, but also you've got to recognize that what we're delivering in some of these larger communities is actually setting up on-site primary care clinics,
Hmm.
and for these larger campuses to where it's a hybrid between that concierge and primary care on site, trying to bring primary care on site to these communities. And it's a little mix between concierge and primary care where we're not going to
That's
charge you
pretty cool.
15,000 dollars a year, because a lot of the concierge practice people think that annual fee. We're also not going to fly a doctor over at midnight to see you, but we're gonna have 24/7 care, right, in some
Mm,
form or fashion. Because you're right, not even dementia care. It's all healthcare is 24/7, 365. But it's a great opportunity, and we've seen tremendous progress and adoption right now. It's our mission to continue to iterate on what we're doing, and we're excited about it because we're seeing the results. We're seeing that buy-in and that partnership, and ultimately, if we can keep one senior living resident
mhm,
in their home, in their community, not focusing on like sick care, healthcare, focus on wellness. How do we keep them
mhm,
well and engaging? What is important to you? Because often, if you come from an acute background, I was a former ICU nurse, seeing the sickest of the sick, and a lot of times when the patients that did really well came back to visit, I didn't recognize them because they didn't
mhm.
look anything like when I cared for them.
Yeah.
It's different when you're a functioning adult and you see a very active 95-year-old that still plays the tuba, right? They still get
Mhm.
the lung capacity to do it. It's important to connect and realize they're not a patient, they're a person. And what is important and what makes them happy?
Yeah.
Is it getting strong enough to be able to connect and pick up your grandson, your granddaughter? Is it be able to, serve yourself food? What is their wellness goals? And I think that's what we're trying to incorporate into our healthcare model of delivery in senior living. And it's really impactful.
Yeah. That's so important, man. A lot of the people I have within my sphere of influence, people that I look up to in this field and related fields, these are the conversations we're having. We've had you mentioned the word buzzword a lot. There's a lot of buzzwords in senior living, and they shouldn't be. So, one example in memory care, we talk a lot about person centered care,
Mhm,
person
mhm,
centered or person directed care, and our version of what you just said for memory care is that there's such a deficit mindset of people living with dementia. And
mhm,
senior living, when it was built 20, 30, 40 years ago in the origin of our industry, beyond nursing facilities, we're a more residential feel for that. But even during that time, I think the root or the origin of how our industry thought about memory care was activities of daily living. When
mhm.
you can't do
ADL.
showers, yeah, good old ADLs. When you can't do showers, you can't take care of your medications, you can't dress, et cetera, et cetera. All of the preceding verbs are can't do this, right?
Mhm,
And so memory care, in a lot of ways, despite our industry's better intentions, ended up in a place where it just became like the last stop in an aging in place mindset. And it's like, these are the people who can't do the most things, so we got to provide them with the most care. Well, that is the lowest bar of thinking about the people we're serving. But to your point, how could somebody who is in a memory care community under hospice services, what are the things that they still are excited about what are the
Hmm.
things that they want to go do, because it doesn't mean go lock them up in a room and wait out the clock. It's let's enjoy life until the very last breath. And this isn't, it's not semantics, it's not a pie in the sky kind of thought. These are actual things we can do.
Hmm.
We see that all the time at Bella Groves. And I think because we're being intentional about involving all the right players in the conversation, we have a shot at it. We have a shot at it. And it's still complex, but at least we have a shot. Our industry still, I think, has a long way to go. I'm excited as you are to participate in this. I'm one of those, how would you say it, Michael? You can kind of you can point to your own blemishes kind of thing, right?
Hmm.
Like I love
Hmm.
senior living so much that I think that we need to be able to address the things that we need to update, and a lot of that is in our own thinking.
No, I think it's a great point, and you're absolutely right. When you've done this, like I have, in 12 plus years, and you've been in the
Hmm.
industry a long time. I've been in healthcare for 16. It's easy to know what you know, but it's a challenge to look at it from a different lens or perspective. And
Hmm.
that's why, at Curana, we've done a really good job about holding on to the legacy and understanding and learning from the past, but also hiring the right candidates and team members and leadership that look at it from a different perspective and complement and are willing to have dialogue and challenge the norm and not just say, well, this is all how it's always been done.
Yeah.
This works. We make money or we get results. And, we're trying to push the envelope in a healthy way that encourages partnership. It gets people excited about our care delivery model. And we have an opportunity to do it. I mean, one thing I cannot understate, and, skilled nursing is a different beast. And a lot of times I found the
Yep. Yep.
misalignment and not even necessary. Just the motivators for skilled nursing and long term care were different from us as a medical group. They're different from the hospital. And there's just this misalignment of incentives. I feel like in senior living, we have so much alignment that just like we're all encouraged to do it because it benefits everyone. And at the center of all is the patient, their
Hmm.
family. They
Hmm.
have better outcomes. And that's really inspiring for me. Being with the company in 12 years, I guess nowadays it's like, you know, I, if anyone's ever met me, they say I've got a lot of energy and I'm a squirrel, but
Yeah.
it
Yeah.
keeps me interested. It keeps me engaged. And, we're solving a big problem that I think we've got a good chance of really making a big impact.
Yeah, yeah. I was gonna say you're doing really well. I know Michael from from class and from hanging out for late night study sessions, and
Yeah.
so yeah, you've been really non squirrel today. So that's great work, buddy. Um,
I
the
try. Only for you, man. Only for you.
this has been a really interesting conversation. Again, not at all on topic with what we
No.
had prepped for. So I think what we're gonna have to do is like maybe do a second episode.
Okay,
And
let's
so
do it.
we'll cue it up here a little bit so that there's a logical like connection between the two episodes. So I do want to come back to that in just a second. Um, I would be remiss not to talk a little bit more about our executive MBA experience.
Yes.
I oh my god, it changed my life. It changed my life, and for me, it was the kind of accelerant to okay, I think I can do this. And so everything I'm doing post MBA with consulting and speaking and Bella Groves and Think Tank, it all just kind of came alive going
Hmm.
through that educational experience for me. So I'm curious for you. By the way, you've given a lot of your money to UT,
Yes.
University of Texas, 3 degrees from UT, right?
Absolutely. They get all my
Okay.
money. When they call
You,
me for money, I'm like, I've already given it. What do you
you're
want?
like, I don't have any more. You got it
Yeah.
all. So let's talk a little bit about McCombs so we can tag them on this podcast.
Yeah. Love them.
What was that experience like for you, having been in healthcare, having been, successful in your career already? Why did you go do the MBA program? And then what did you get out of it that you're like, I'm glad I did that?
So I'm going to tee up our next conversation.
Hmm.
I had a great mentor that did the program 5 years previous, physician founder named Dr. Tony Gamboa. Phenomenal, just someone that we'll talk more about next time we get to
Hmm.
chat. But
Yeah.
that was one of the motivators for me. The other part is a lot of people said, "Why an MBA, not why an MHA?"
Hmm.
And so to me, it's like I understand healthcare. I may not know it all, but I understand it. I want to learn from engineers, rocket scientists, PhDs in statistics, like Sing Lai. And
Sing
so
like
yeah, and so I want to learn from different people and be
yeah.
challenged in a melting pot of thought, because healthcare, I know it. I'm not jaded,
Hmm.
but I know it, and I can
Yeah.
breathe it, and I think I can educate to it. So that was really important. I think also, as a background, we kind of touched on, a male nurse, right?
Hmm.
Minority, but growing. Male nurse practitioner. Went back and got my nurse practitioner, served in this space. But when you look at leadership in healthcare, a lot of times when you're clinical, large companies, I won't name them, typically say, well, you're a physician, you're going to move up. Non physician doesn't matter. So there's always an innate insecurity. And I think we're motivated as human beings with these
Hmm.
healthy insecurities that push us. Some people recoil, some people push against them, right?
Yeah.
I think I have very good self awareness of my own insecurities, which we all do. My wife will tell you all of them and put them on a list for you.
Yeah.
She knows me better than anyone.
I'll
But
email her.
yeah, do it. She's way better, and she's a speech language pathologist too.
Oh, love it.
And so for me, I had this innate security. I knew we were a successful company. We're growing.
Hmm.
We were going to be acquired at some point. And I didn't want to be seen as Michael, the nurse practitioner, even though there's nothing wrong with that.
Right.
I wanted to be seen as Michael, the executive.
Hmm.
And started the program, got to learn from amazing people. And you know what? Exactly what I was worried about happened, but in a good way. We got acquired by private equity, a great company called Lorient Capital that's out of Detroit. I think they now
Hmm.
office out of Miami, because who wouldn't compare it
Yeah.
to Detroit? And they saw me as Michael the executive because I was in a prestigious executive
Yeah.
MBA program from a top 15 program, the
Yeah.
McCombs School of Business. But that's a selfish reason. What I got out of it is even more,
Hmm.
because I love relationships. I love getting to know and connecting with people, challenging people and having people challenge me. And I felt like, although, even though the content was amazing, the interpersonal communications, the connections we made will last me
Hmm.
a lifetime.
Yeah.
Right. I think that being a part of a fabric of, of a program in University of Texas, I love. I mean, obviously,
Yeah.
I'm a huge fan.
Yeah.
Del Conte, the athletic director, I had him had interviewed him for a leadership class. I brought him to speak. We took him to
Hmm.
dinner. That guy's doing amazing things. Look what our football program's at. I mean, obviously, a big program, but to me, it was so amazing. It
Yeah.
was a thing that I don't even know if I could do today,
Yeah.
because got two kids now. I had one and one on the way during the program, because just the commitment. But I love how we all invested ourselves in it in the moment
Hmm.
to really dedicate and say, I'm here. Although life is there, I'm committing to be here.
Yeah.
And I think it made everyone better. Don't you
Yeah.
agree?
It changed my life. I was in the same boat with you. We had our daughter in 2019, so that was right in the middle of the
Hmm.
program. And we all know what happened in 2020 with the world. We didn't
And
get to have our.
We got lucky because we only did a few weeks. The
We
class behind us
only
suffered. I felt bad for them.
Yeah, yeah. We only had a few weeks of the Zoom classes, but we had, for the most part, I'd say 95% of our MBA experience was live and in person. It changed my life. I was at a crossroads professionally where I love the industry. I knew I wanted to be in it for for the long haul, but I felt a deep frustration, with it. And I know what you mean about that internal kind of insecurity barometer. It's strong in all of us, but
Hmm.
I think what I relate to also about you and a lot of the people in our program was that we cared enough to like specify that self awareness. It's not enough to say, "Oh, I'm insecure about this." It's really dialing it down to beyond um, imposter syndrome.
Hmm.
That's another buzzword, but it's too big categorically. I think the program allowed us to really dial in a little bit and um, explore things outside of the bubble of senior living for me anyway. Of I got to experiment with ideas and things that we had 59 other people in the program that um, they didn't have any preconceived notions about senior living, right?
Hmm.
So
Yeah.
it was like all they could do was like listen and ask questions, and it was so helpful for me, man, because every other conference I go to, every other gathering I'm at, it's like, oh, what do you think about the guide model? Everybody has an opinion about it.
It's all group thing too, right?
It
You
is
just
all
everybody.
groupthink. Yeah,
Hmm.
but steel sharpen steel, and the executive MBA program for me was that I had to confront all of those feelings about, okay, am I smart enough to be in this program? I don't know if you
Hmm.
thought that, but I was like,
I have a speaking point on that, and
Yeah.
you're absolutely right. And I think it resonates really well with me because we had a rocket scientist in our class.
Yeah.
We had, and so what I realized, I've always known this. I'm not the smartest person here. I feel like I'm
Mhm.
okay, but I'm not.
Mhm.
But no one came to that program with a full deck of cards. Everyone
Mhm.
had a weakness. Those that
Yeah.
were the top upper echelon of intelligence, they came for soft skills.
Mhm.
They came for the things that come maybe natural to you, James, and the content you put out and the way you're able to connect and communicate and show empathy. They don't have that, and that's
Mhm.
okay because they learned and they opened up. And here's a small thing that Jennifer Ratliff, she lived in San
Yep.
Antonio. She
Yeah.
moved.
Just saw her a little while ago.
Oh, great.
Yep.
She's phenomenal, super smart, finance background. And I remember early on, didn't know her from anything, right? Just barely there, and I could tell she's shy. And I encouraged her to speak up, just not even thinking. I was just encouraged, like, hey, you know this, just answer it. Like, small side comment. Went
Mhm.
in throughout the day. She spoke up something, and she came back to me later and said, hey, I really appreciate you encouraging me because otherwise I wouldn't have spoken up. And I
Yeah.
think those are the moments that were impactful that I was like, wow, hopefully I attribute value because I got a tremendous amount of value from everyone. And so it's nice to give back because I think it's great. And we really helped
Mm.
each other because no matter how smart you were, how outgoing you were, you had an opportunity to learn and come out of that program better. And they did a really good job of making sure you did.
Yeah. I got to be honest, the event that I started putting together for our industry called the think tank, a lot of it is just it for me it's a replica of the experiences we had at the MBA program of all of these different thinkers and brilliant people had to come in and we had to work on stuff. So it
Mhm.
wasn't just get a round table together and let's talk about stuff we already know. We
Yeah.
had to apply that conversational skill set into a topic that was outside of ourselves.
Mm.
So, being in a class like strategy or being in a class like
Hmm.
negotiations, I mean, that class alone, for me, was like worth the cost of the tuition. But for everybody, there was a different class or there was a different thing that was like, I'm glad I went, and this thing
Hmm.
has changed the way that I approach work. And the thing that I'll say is that the MBA program helped me go from an employee mindset to a business owner mindset. And
Hmm.
that to me is priceless.
No, I think it's phenomenal. I mean, it's the funny thing is I went into it thinking I wanted to be an entrepreneur,
Hmm.
right? And I went into new venture
New venture.
creation,
Yeah.
and it challenged that thought. Do I want to? And I kind of recoiled a little and said, I don't know if I want to, because
Hmm.
Rob Adams said correctly. 4 to 5 companies fail. So you know how to
Yeah.
be 100% effective. You start 5 companies,
Right.
and it didn't dissuade me, but I didn't excite me there. But
Mm,
what's funny is it didn't discourage. It informed me, and so much to where my wife on the counterpart is a very much like she's got all these amazing ideas.
yeah.
So maybe she's the entrepreneur in the relationship. I can bring the business part back, and I need to encourage her and be her biggest supporter and investor. But to me, that was insightful because I thought I was one thing, came out of it coming in, and maybe I'm not as much. Maybe I'm 20% entrepreneur, but 80% not. And so
Mm,
it's just great for self discovery during the program because you come with your own preconceived notions. You
yeah.
learn from experience, business operators, experienced people in their fields, and it changes you,
Yeah.
right? And so for some people, it made a change some 2%, but it changed you what you gave into the program. And I think that's where you saw it. And whether you got the most out of finance or you got the most out of the relationships developing or you just enjoyed the food that was part that you paid for, it's you get what you put in, and it really was. And so I
Yeah.
appreciate the program over there. Love opportunities to give back. Honestly, I've been so busy in my work career that I haven't been able to give back, but I need to make note to do it. But I've stayed connected with like our
Yeah.
group.
Yeah.
The last 2 semesters, we still on a text chain. We talk.
Yeah. Yeah.
So
It's amazing. And it made me connect with you here,
mhm.
for this conversation. It's just I don't even remember what it was. I was just like, I'm gonna text Emery and
I was just hoping. I didn't want to
yeah.
reach out and be too needy, but I'm so glad you reached out first.
Yeah, we got somebody's gotta take the first step. So
No, I'm
uh
glad you did, man. This has been fun.
yeah, we gotta do it in person next time for sure.
Sounds good. Let's go.
Yeah.
Just a short drive. My father-in-law lives in Stone Oak. I've got friends in
Oh
Bulverde.
really? Hmm.
Yeah.
Yeah,
So
well, you should come by. From a business perspective, you should come by and we should
yeah,
meet. I want to show you Bella Groves. We're really, really excited about, all the stuff that I get to share on LinkedIn. It's like it's 5% of what we do, because
yeah,
I also don't want to saturate, content with just a single part of what I do. But so many people have reached out, and I think that is a thought, between my podcast or speaking or whatever I get to do in this field. I want people to know that you don't have to be at $1 billion a year company. You don't have to have a big business pedigree. I don't. All of these things we learned for ourselves. We put ourselves out there. We were open to being changed through processes like the MBA. We dig deep. We get into the weeds of our own profession. Like you probably bore people to tears who are outside of the
yep,
work that you do, just like I probably do. But when you are with people who understand and are in the weeds themselves, I bet, yeah, you could talk to them for hours and be enthralled, right?
absolutely.
So it's the encouragement I want to give to people. Whether you're listening to this podcast or, well, I guess if you're listening now, you are listening to the podcast. That logic follows. But the message I want to give is that you can influence this field whether you work for a ginormous company or a single mom and pop standalone memory care like Bella Groves.
Absolutely. It's a
Yeah.
butterfly effect. I mean, I think, James, not to inflate your ego, I do think I'm a little envious of your ability to communicate in a very sophisticated but very very soft way. Very you
Hmm.
show so much empathy and caring, but genuineness is what's communicated across social media, which can be very fakey at times. And I think
Hmm.
that's very. I've noticed that. I've commented about that. Just excited to see your growth and your brand awareness has grown because I do believe the bigger you get, the more people that are impacted, and the better off they are for it. So
Yeah.
if you're listening, tell 5 friends, have them chime in and listen. I think that's the best way to do it.
Yeah, I appreciate that, man. It's not often when guys get together and compliment each other and then don't laugh it off with some sarcasm, although we do plenty of that.
Oh, plenty of that.
We do
Plenty of
plenty of
that.
that. But I think this is the spirit of finding people that you have the same vibration, and
Mhm.
support each other. We covered so much that we didn't plan on covering, and
Yeah.
that's sign of a good friendship too. You can just
Yeah.
talk about whatever comes up.
Yeah. It should be I think it should be a conversation. I think it's two
Yeah.
like-minded individuals that enjoy each other's company and can, talk and try to, discover like, what are you doing? What am I doing? How do we coexist? This has built something bigger. And I think that's what it should be. It should be a conversation. It shouldn't
Hmm.
be two robots reading off a predetermined script. It should be, I mean, we didn't cover mentorship, which maybe we'll talk to
Not
next
at
time.
all. Yeah.
But I think that's a sign of a hopefully a great conversation. And if
Hmm.
if you, people can pick a couple things out of the conversation and find value, I think that's tremendous and it's
Yeah.
impactful.
Yeah. Well, let's cue this up for the next conversation that we'll have together. And the role of mentors, the role of great coaches. It's something that is very near and dear to me in the way that I hope um, I lead by example to other people who are going to come up behind me. And I still have way far to go in terms of my own growth. So I'm certainly not sitting on a mountaintop here. I think it's a lot more of we're climbing the mountain together, and let's make sure we're bringing people up with us too. So before we get to that next conversation, I am curious why when I approached you and we started thinking about some topics, some leadership topics, what teaser might we have here, Michael, of why mentorship kind of rose to the surface for you?
No, I think for me, it just was a natural. I didn't have to think too hard about it,
Hmm.
and it's not something I even think about daily. But I know I am where I am because I have or had good mentors,
Hmm.
right? And it's either those you seek out or those that seek you out. And it doesn't mean you can't be successful without them, but I believe it's so necessary. Whether you're a small startup or you're a large organization, having someone that believes in you and challenges you to make you a better person and
Hmm.
helps develop you. So mentorship isn't saying, "Hey, follow me and be me." It's take elements of what you do and what I do and learn from it. But you also have to have other mentors. So I don't think there's even one mentor that's good enough for everyone. And I mentioned Dr. Antonio Gamboa, Tony Gamboa, good friend of mine. I actually got to see him. I haven't seen him in a while, but I saw him last night. And what he said, he's like, "Hey, at some point, I won't be able to teach you anything else, and you need
Yeah.
a new mentor." And I
Yeah.
think that was so self-aware of a guy, of a professional that has started businesses, been successful multiple times, a top class physician, and say, you know what, I won't be able to do everything for you, and you'll need
Love
someone
that.
else. It's amazing, right?
Yeah.
I mean, that's exactly what you want in a mentor. And I've been blessed. I can think back when I was a nurse, and some of the nurses that taught me that have been doing it for 25 years. And Carolyn Schwartz is one at North Austin Medical Center. I remember she called us
Hmm.
nurselets. We're a little nurselets when we're turning, and you know what? That's fine.
Yeah.
And you know what? I learned from that. Tina Brongdino give me the hardest patients in the ICU and saying, "You're going to figure it out, but I'm going to be here and I have your back,"
Yeah.
and challenge you to be better, not just say, "You know what? I'll take the easy patients. Give me the hard assignment." That hard assignment, those hard assignments forced me to learn, forced me to connect with physicians, discover more about the patients and why they were doing it. That sparked me to become a nurse practitioner. Nurses are amazing. ICU nurses,
Hmm.
some of the best. I'm very biased. ICU nurses are probably the best, but
Yeah.
that'll require a whole debate. But I wanted more. And in that mentorship likely sparked that aspirational creativity, that thirst for knowledge to learn more. And that caused me to be a nurse practitioner.
Yeah.
That motivated me to be, and then motivated to get my executive MBA that allowed me to meet you and be on this podcast. I think that's how mentorship, not only receiving, but how can I give back and be mentors for others?
Hmm.
That's it.
And that's it's a really good thing to think about. I've had the privilege to be a coach, an executive coach to some business owners in our space, and each of them we naturally came to a conclusion, and it just, as you were saying that, it really rang true for me. I don't think I used those words, but there was a genuine sense of like, we served the time together that I could have been helpful to you, and so the isn't that a great thing that a good mentor, coach, advisor to you works themselves out of a job?
Yeah. I think you should train people, and there's that old adage, but I won't say it. But it's like you should train people to be able to say, "Hey, you can do my job," and not be
Hmm.
threatened, because I can't level up unless you
Hmm.
do. And I
Yeah.
think that's impactful. And right now, my current boss, the president of our company, he comes from policy background, completely different than Tony, my previous
Hmm.
mentor, but there's so much value I get. It's a
Yeah.
different lens. And to me, it's like I have so much to learn from him because his unique background experiences, and I'm better for it. But now I can be a better mentor. And I should never be threatened that those
Hmm.
that I develop, and young leaders, I think, struggle with that so much, is that
Yeah.
they
I
they
did.
they, they can't transfer from doer to leader.
Hmm.
Leadership is getting stuff done through other people, but
Yeah.
also entrusting them the opportunity to do it and not be so insecure that they could potentially take your job.
Yeah.
You know what? You should train them enough to where if something happened to you, they could do your job, because that means you're doing the right things. And that's where young leaders struggle sometimes, is
Hmm.
giving up to grow,
Yeah.
slow down to speed up. So,
Yeah, yeah, I can relate. I struggled in the early years of leadership when I was in my mid 20s, late 20s, early 30s. And it's not just about age, it's about your first opportunities to serve other people. But I, looking back on it through, 2020 clarity, I can see that I was at a place, and there are times it kind of still pokes through here and there,
hmm hmm
because we're never fully formed. We're never fully
yep.
arrived. We always have those little things. But I remember looking back, or I can recall now looking back, that I needed to have the best ideas. Like it. I got a lot of like, oh, like such a high off of, because when you're little and you're in high school or whatever, you have a brilliant idea and they're like, oh my god, James has such a great idea, and then you transfer that into leadership and you're like, okay, I'm the leader, I need to have all the best ideas. And I remember the failures I had as a leader because I didn't create enough space for other people to feel brilliant. the only thing they could say is, James, how brilliant you are. And but I've learned painfully through those growing pains, through those processes, that if you're going to be an amazing leader, if you're going to be an even better than average leader, you really have to put yourself aside and think, all the things that I want to enjoy as a professional, now I'm in charge of helping other people experience that.
Absolutely. I mean, I 100% agree. And it's, very similar. I'm a
Hmm.
very, some people say I'm outgoing. I don't know if that's true or not, but
Hmm. Yeah, let
I'm a
me write
talker.
write that
Yeah. Write that down. Yeah. Just in
write
case,
that
look into
down.
that.
I just
But
learned Michael is outgoing. How about that?
I think when they did the personality test, I was like on the far end of everything.
Yeah.
Me and Jessica, right? We're just way out there. So, um, I feel absolutely same, very similar. Is that I feel like I needed to get recognized and position myself. I
Hmm.
needed to speak, and now I've taken an alternative approach. I frequently lead meetings, and it's to me, it's like, hey, y'all aren't here to hear me talk. I want to hear
Hmm.
you talk, and encourage that dialogue and that thought process, and ask, two levels down, what do you think about it? You've been quiet. Is this a good idea? Push back. Tell me, because there's nothing sacred here. Titles go out the door when we're conversating and we're trying to solve a problem. I'm one perspective.
Hmm.
You're another valuable perspective. And I think it translates not only to the business world, the clinical world. When we look at who's providing and who has the most touch points on those that we care about,
Yeah.
it's the CNAs, the med techs. It doesn't mean they're any less important than the physicians, the nurse practitioners. Because the beautiful thing and the perspective that I've always cherished that I have is I've been a CNA.
Yeah.
I've turned patients. I've wiped their backside, cleaned them up. I've been a nurse. I've been a sitter at times when I was in
Hmm.
nursing school so I could try to study. That's the biggest fallacy. Sitting someone that has, a diagnosis of active, you just follow them around. You don't get to read anything.
Yeah.
But I think it's just we all can contribute and we can all learn as leaders. And if you just stop and think you know it all, you're failing.
Yeah.
You've got to
Man.
iterate, you've got to learn and just be a humble servant leader. And that's what I really try to model myself after. And I love that when people challenge me and say, hey, and because I take that perspective and I don't get offended by it.
Yeah. In our program, we had a lot of debates in that classroom, and it it was a arena for us to not even get better at winning arguments. It was an arena for us to realize, okay, we're in a room full of really, really smart people, and not any
Mhm.
one person will ever rise to the top as like, oh wow, that person always has the right answer.
Yeah.
It was a lot of back and forth and learning, okay, in a room full of really, really smart and capable people, how do I fit in and how do I contribute? And so I learned so much by being around such smart people, that it gave me more confidence to realize I don't know a lot, and look how much everybody else knows. It feels counterintuitive that being around other accomplished people would make me feel more confident, but it did. It helped me see kind of
Mhm.
my my like harmony, my balance of all of that.
Yeah, I think a big thing is you kind of resonate. You look around your group of friends, your group of
Hmm.
colleagues. You rise to the occasion. If you're with people that are not compliant, kind of shady, like you're gonna sink down to their level. You're gonna rise
Hmm.
to the level, and so I think it's continuously good to have different viewpoints, but of ethical people that really
Yeah.
want to contribute and grow together, and that's important. And they need to be different viewpoints because groupthink's real, and when you're in a business call and business meetings and functions, they know it, right? They
Yeah.
get it, and it's easy to throw an acronym out, but when someone says, "What is that?" You're like, "What's guide?"
Hmm.
That's great. I got to learn it again. I
Yeah.
have it somewhere in my brain, but it's the simple things. And, my wife does a really good job about that because I speak it, but then I know it, but can I articulate it?
Yeah.
And that's a challenge that I love to do is say, so, you know what? Let me look that up because I'm not going to just BS you. I'm actually going to look that
Hmm.
up, make sure I bring that from the back of my brain to the forefront of my brain. And it just adds to that level of learning, which we should always continue to learn.
Yeah. Man, we covered a spectrum today.
Yeah, we
Man,
did.
we did. Okay, so we are still going to do the other conversation. We'll circle back to that. I want to. So I started hearing this in a podcast and I loved it. So I'm going to start adding it in. You're the first person I'm going to ask this
Let's
concluding
go.
question to. So in my Level Up podcast episodes, I learn a lot from my guests, and I learned a lot from you today. Thank you for that. I like the idea of podcast host kind of flipping the roles here. And the question is, do you have a question for me. So, I'm in the senior living space. I'm an owner operator. I have a different viewpoint than you on things. So, if you had a small segment to learn here from me, what question do you have that I could answer?
I have two, and I'll go with one first. For me, when what pushed you over the edge to be able to take that step to start Bella Groves? Because that's a huge threat. Like, people, have ideas all day long. A lot of people struggle with that. Like, oh, what about this? Oh no, I'm not going to do it. It's too expensive. Or, I'm the sole income. I can't do that. What allowed you, not only the MBA program, but what allowed you? Because that's a great resource. But how
Hmm.
did you take that next step to say, I'm committing, I'm doing this,
Yeah.
I'm proposing, I'm saying yes, I'm signing on the line, we're doing this, and I'm taking the risk?
Yeah.
Was there a singular thing, or was it a compounding, factors? What was
Hmm.
that?
Yeah. Um, Good question. As I think through that, no, there wasn't a single event. And I think, like all good things, courage is compounding. So you have a little bit of courage, and then you realize, oh, I didn't die. You have a little bit more courage, and like, okay, you can keep going. And I actually think of a lot of things that way, even writing content on LinkedIn. If I
Mhm.
go look back at content from 5, 6 years ago, those were my toes in the water, dip my toe in the water and
That was
figure it
my
out.
second question,
Yeah.
actually.
Oh, really?
How do you stay motivated in creating meaningful
uh,
content? That was actually my second question. That's
Yeah,
hilarious.
yeah. Well, okay, I'll come back to the second question, but the first question is, the answer to the first question is, I knew going into the MBA program that I hoped to make a move into some kind of an entrepreneurial space. My dad was a small business owner, and there was just something in me from the very beginning that said, I want to create something kind of of my own two hands. That's not a motivator for everybody, but it's innate in me. And probably, if we're looking at all honest aspects of it, there's a degree of controllable factor that I think really appeals to me, not in a like a chronic bad kind of way, but I
Mhm.
really love the idea that I am the master of my own successes and failures. So through the MBA program, my first kind of toe in the water after that was breaking away from corporate senior living and saying, I'm going to go do some consulting. And so I got my first book of clients through contacts and people that I knew. And so it was just a little bit, it was just a little bit of courage. It was a little bit of, okay, I feel like I can do this. And then I started the podcast, and I was like, it, in a lot of ways was, that assignment we had in leading people in organizations, where we had to go interview somebody we wanted to talk to and then create a
Mhm.
leadership thing out of it. That really did give me the inspiration for this podcast, which was,
Oh, wow.
how can I go find people that I want to talk to? Why would they give me time? Invite them to a podcast. So
There you go.
I learned that from LPO, leading people in organizations. So, and then that led to another thing. And then my partners at Bella Groves, originally, I got in touch with them, and I was just advising, and then it turned into consulting. And then at some point, the two of them, who are not from the industry, one of us just was like, "Hey, I think we're kind of flirting with the idea of a partnership." And I was like, "I think we are." And then we really kind of fleshed that out and realized, okay, so you guys did a lot of the pre-work here of creating a company and entity. And at that point, it was still a paper company. And I had all of this just passion and ideas and things that I needed a space to create that.
Mhm.
So it was an
Mhm.
alignment. And I'm always careful to tell people, I'm not the founder of Bella Groves. I'm the co-founder of Bella Groves.
Mhm.
And I'm
Mhm.
very, very proud of the co part of that.
Yeah, that's
Yeah.
important.
Yeah. So there was no, I think that whole blind courage entrepreneurial like madman it's a false image.
Mhm.
And so I am a little bit more calculated than people think, but it's a lot of small courages that have compounded into bigger ones.
I like that.
Yeah. Second one was LinkedIn.
Just I think it can be short and brief, but yeah,
Mhm.
yeah. How do you stay passionate,
Mm.
engaged, excited about creating content? Because a lot of people, I'm gonna say influencer word has a negative connotation, but how do you continue to want to put stuff out there and say, hey, I've got this idea? You probably have hundreds of ideas, but
Mhm.
sometimes they're exciting. Sometimes you may talk yourself out of sharing them.
Yeah.
Is there any like one strategy? Is there anything that just motivates you? Or you mentioned you do only a handful of podcasts, which I think is right,
Hmm.
to kind of keep that cadence. But
Yeah.
any kind of secret sauce or anything there?
Yeah, for LinkedIn, I do love this question, and I get asked a couple times and it's the consistency. It's like,
Mhm.
hey, one great post or two great posts, but how and why do you post all the time? And then the other question that is usually tagged with that is they're mostly all good. Like
Mhm.
you might have one kind of most people might have a really great post and then everything else fizzles. So here's my answer to that question, Michael. I have had to attach the meaning to the activity outside of LinkedIn, outside of
Okay.
social media. And so for me, the discipline and the practicing of it, um, we all have something in our lives where we practice discipline. Some people it's
Mhm.
running, some people it's waking up at a certain time, some people it's eating healthy. Um, I don't think you need to be disciplined in every aspect of your life. I think you need like a focal point.
Mhm.
So, like when you're doing yoga, right? You may focus on a single thing or a
Mhm.
single tone. And so for me, LinkedIn is the focal point of I just want to practice communicating. I want to practice writing.
Mhm.
I want to practice articulating my ideas to other people.
Yeah,
So for me, I think of LinkedIn as it's constant feedback from other people about how well I'm communicating a story.
I like that.
To
I
me,
like
these are
that.
all data points. And
Yeah.
so in my mind, I don't dread waking up and be like, oh, I got to make a LinkedIn post today. It's just become a discipline in my life to become a better communicator. And LinkedIn just happens to be the tool used for that.
Awesome, man. That's
Yeah.
great.
Really good questions. Man, this was fun. This is going to be a long ass episode. So we're going to have to,
Yeah.
we are going to have to edit this down probably a little bit, but we may go Joe Rogan style and just like, here's the full
There you go. I mean,
hour and
I
a
think he's doing
half.
pretty well, right?
Yeah, he's doing okay. Yeah. Good talking to you, buddy. Thanks for joining me for this.
Pleasure. I mean, just I really appreciate this. This is fun. I mean, this is
Yeah.
easy. This time flew by, and it's just great to reconnect. We don't do this enough, and so
Yeah.
I'm so glad you reached out because I see your stuff. I may not like everything, but I do like everything.
I appreciate it, man. All right. So, for our listeners, I'm going to include some information, some links here from Michael Emery and his company. If you want to learn more about not just his company, but continue this dialogue that you heard here on the podcast, reach out to Michael, reach out to me. And yes, there will be a second episode featuring Michael Emery, and we're going to dig deep into mentorship. So, thanks everybody for listening. Thank you, Michael, for joining me. Have a great day. Thank you so much for joining me for this episode of the Level Up Leadership Podcast. If you enjoyed this episode, please consider subscribing to the podcast and its YouTube channel. Better yet, share it with someone you know who is on their own leadership development journey. I hope you'll be back for the next episode of Level Up. But until then, I hope that you are leading well and remember that you are living your legacy today. So, make it a good one.